Hey, I'm Diane. I am about 3 months and a week past having a posterior cervical laminectomy with fusion surgery. Had that done in mid-November. And it's time for me to give you an update as to how I'm doing and some of the tips and tricks that I've found to kind of go through the recovery of this. So I appreciate you tuning into these. I've created these videos because I've found that there were a lot of videos online for the ACDF surgery, the anterior, where the surgeon would go in through the front of the neck, but there seem to be not very many for posterior. So I'm trying to do my part and give you some hope that you can get through the surgery and that the progress through the recovery is something that I think we can all take some hope from. So first, let me just talk about what some of the symptoms were that I had before the surgery. Primarily, my problems were in my hands. I had issues for months with a lot of pain and lack of finger coordination. I eventually started to really kind of be able to pick up small things, to put on earrings that were anything but hoops because I could just push the thing down, or be able to do buttons very well. I'm a keyboard player, so I was really starting to lose a lot of my ability to do that and get my fingers to do what I wanted them to do. And so that's where the symptoms really started for me. But then it increased much more into my balance and mobility. I think one of the first things that I found was I had a lot of problems like lifting my legs to go upstairs, and I thought maybe I'd just done something to my back or something that promoted that. But then it progressed into real balance issues where I started falling down a lot. And that seemed to progress really quickly before the surgery. So as far as how that's gone since the surgery, my hand symptoms, the pain in my hands has primarily gone, and the burning and the tingling, the burning I should say. I know when I've done too much in days since the surgery that I feel that pain in my hands again, very much across like the bottom of my palms. I had a lot of pain there. And that comes back, but then, if I behave myself and try to just not do as much, that pain goes away. So that issue, I think the surgery solved very quickly, and I've even seen some progress since then. That's been good. It's been a bit of a trade-off that I think since the surgery, I've been having a lot of numbness and tingling in my hands. That honestly may have been there before, but it was masked by the pain and I couldn't really tell. So that's still something that I'm sort of just trying to figure out how to work around. I've also lost a lot of the ability to feel texture and temperature in my hands. I can have a little bit in the back of my hands, but not very much in the front. I'm hoping that that's something that does come back as more time progresses. I've been told by my surgeon and have just heard from other people who've had the surgery that the spinal cord takes between 12 and 18 months to really restore itself back to standard operating procedure after being compressed. And I think the longer it's been compressed, the longer that time takes. So I have to learn to be patient, which we all do, and it's not easy to do. But I'm hoping that some of these issues in my hands, that time and just proper exercise and use and so forth is going to help that to be restored a bit. So that I get some of the feeling back in my hands too. So, just looking at my notes here a little bit. So since the surgery, let me tell you about what my progress has been. The balance issues since the surgery have been really helped considerably. I don't feel in fear that I'm going to be falling down all the time like I was to the point right before the surgery, where I was, even using a cane to some extent just to be able to make sure that I wasn't, face planting with just normal activities. I still do feel a bit off balance if I would be taking a step back for some reason. If I'm working in the kitchen and I sort of turn around to grab something else, I can feel very kind of unsure at that point in time. Doing things like stepping on an escalator or something like that, I feel uncomfortable with that, and always try to make sure that I'm paying attention to my balance then. But that the surgery has really helped that. I am going through physical therapy, and I kind of got an insight that my balance wasn't as good as I thought it was when I started doing some of their balance exercises there. But through the time that I've been doing that, I think I've seen some improvement there. So I'm hopeful that just gets to be pretty well taken care of as time goes on. It's been really important for me to take very regular walks. I think that just, obviously helps to work out everything in your body, but really helps to just get the muscles in your neck back into normal usage as well. So I try not to let them be any less than like 1.5 miles or 2 miles, and I've gone farther than that on a number of occasions. Yeah, I get tired from it, but I think the walking really helps, just to make a priority of that, to make sure that I'm, just trying to be moving on a regular basis. So I would absolutely recommend that as soon as you are in a position where you can start walking, that's honestly one of the most valuable things that you can do. So, make that a priority as much as you can. Since the surgery, now, like any of us who've had that, we probably haven't had very much neck pain before the surgery, but after the surgery, that's a different story. We've been sliced and diced, had a lot of muscles either cut and or moved, nerves the same thing, and then with the laminectomy part, it's actually, removing a piece of the vertebrae. And in my case, I didn't have any sort of cadaver bone or donor bone or anything like that. My surgeon just kind of ground that up and with some other material, I guess, used that as the basis for what the screws and the rods are in my neck. So the neck pain since the surgery has been significant, but at this point, and honestly since like 2 or 3 weeks after the surgery, I've been able to control that pain well with just Tylenol and Advil. And at night, I do still take a muscle relaxer pretty regularly. I find that through the day, I get increased pain and just from tightness, and so the walking helps that, but I think it's just kind of the nature of the beast that your muscles still get tight at night. So I have been taking a muscle relaxer just to kind of help that, and that helps with the pain that's there for the most part. A little bit of a show and tell here. I would absolutely recommend one of these heating pads that is curved, and then it can actually like snap around your neck, so it sits just right on your neck and shoulders. I got this from Amazon. I can add the link in the comments as to where you might be able to get that, but that has been super helpful for me. In the beginning, ice was the biggest thing for me post-surgery. Regular ice packs and changing them out to make sure it was considerably just still a cold environment for it was really important, probably like for the first month to 6 weeks. But then from that point, heat has really helped with, I guess, promoting the circulation and just getting your muscles more comfortable with the heated environment with that. So I take it with me just about everywhere I go. I feel like it's a security blanket almost, but it is very helpful to just regularly have on that snap-on heating pad that just rests right around your neck, rests right on your shoulders. And I can sit at my desk and type and all that kind of stuff with it on, and I just really find that to be helpful. So I would recommend that you get one of them. Physical therapy has been a big component in what I've been doing in my recovery. It's been really helpful, as I mentioned, with working on balance stuff. And in the beginning, I could barely turn my head at all after the surgery. So that I would get back to the point that I could feel safe driving and that others would be safe and so forth too. That was one of the biggest things, to start really be doing exercises. I could turn my head. I really have a lot of rotation now, much more than I did. I can lean my head back and forth some, and I don't have to show you all these things, but it is super helpful to know that I have just really been able to regain a lot of mobility in my neck, and that helps with muscle movement all over too. So that's been a priority of what I've been doing. They've been doing a lot of nerve massage and all that kind of stuff with it too. I don't know the technical terms, but I think it's just really all these things to help your nerves come back to life after the surgery, the spinal cord, being chief among them, and just get back to their normal operations. I've also been doing a lot of exercises with my hands and fingers to help promote the mobility there. As I mentioned before, I'm a piano player, and before the surgery, I had maybe like 5 to, or maybe sometimes 6 fingers that would behave well, and now I'm probably up to the 7 or 8 finger point, and I'm hoping that all kind of comes back too. So I've been doing a lot of squeezing and manipulating various things with physical therapy that has been helping me with that, and also with my fine motor skills, that I've been able to just not drop things all the time and still be able to pick up things and kind of have that normal thing. Another new thing in my life past surgery is the use of a bone growth stimulator. This was something that was prescribed by my surgeon, and I know I've seen that there are maybe not everybody gets this covered by insurance, and mine at first didn't, but then it did come through that they approved it. So I wear this 4 hours every day, or at least I try to, 4 hours every day, and I'm to wear it for 6 months. So it's not uncomfortable. It's a little bit of a hassle to try and work around. I'll show how it goes on. Just goes right over your head, and this is a timer function that is set for my 4 hours, so I just push that and it counts down. If I have to take it off at any point in time, I was instructed I should wear at least 1 hour at a time, but it doesn't have to be 4 hours consistently. So a lot of times I will put the neck heating pad on underneath and then this on top of it, and that kind of helps comfort level there. I'm not an expert as to what this does, and I will, this is an OrthoFix bone growth stimulator. So I will add the link to that down in the comments as well. So if you want to read a little bit about what's on the site about what exactly it does, but in short, as far as I understand, it sends electromagnetic pulses right into the area where my fusion was done. And this is in some way helping the fusion to become more concrete and, that everything is just kind of more solidified there through the use of this bone growth stimulator. I can't tell you any more than that of how it works, but that's the premise behind it. And I've been trying to do that pretty regularly. I have tried to sleep in it a few times with some levels of success. I see that people do that, and that's how they get their 4 hours in, and it's not really anything that affects their day-to-day life, but I don't find that to be really easy to do. So, I can sit and work with it on most times and get my 4 hours in that way. So, but I figure if it was prescribed to me to be helpful, I want to do all I can to help promote the success of this fusion. And if this helps to do that, yep, I'm on it. So, the only other thing, I mentioned about the heating pad. Help me just go through my mental list here to be as helpful as possible with this. I'm not going to sugarcoat it. The recovery from the surgery has been a bear. It hurts. We're all scared before we go into it because a lot of things are changing very much with how our body functions. And then after the surgery, it is a long time that you're dealing with at least some level of pain with it. But, that's I think going to be what happens when, especially with this posterior surgery. I think, just going in from the back and affecting all those muscles and nerves the way this does. The recovery is slow, so patience is necessary. And that's not one of my fortes, but I hope that I'm learning it better through this. The other big thing that I will just stress is the lack of stamina that we have after the surgery. I'm a little past the 3-month point, and I have pretty much a desk job. It's about a 45-minute commute for me each way to my job. And it just has been in the last few weeks that I've been starting back a couple days a week, and I don't even really make it the full day. I'm pretty good in the morning, feel really good, really energetic, but as the day goes on, it's just like water going out of a bucket of just being tired. And from what I understand from others who've had that surgery, that is the norm, and it is, I don't know, maybe I've seen some say at the 5 or 6 month mark, they've seen, good things start to happen as far as that increasing, and I'm hopeful for that. I'm not there yet, but I'm really trying to do what I can to rest when I can. I know when my body just gets to the point it can't do anymore, I can't push it because I think that's going to cause further problems. So in whatever regard that I have to be able to just lie down, close my eyes for a little while, that kind of thing, it helps. I know not everybody is in that situation with their jobs and so forth and with family care. So, but as much as you can find a way to do that, I think it's just necessary. You can't push it. I don't have anything to draw from as far as extra strength at this point, and if I were to really try and push it, I think it could actually be something that would cause damage. So we just have to be patient with strength coming back from this and realize that the lack of stamina is just a part of life, and do what we can to work around it and try to just rest when we can appropriately, so that we keep the good things going with this. The final recommendation I'll make is that it's just really helpful to talk to people who have been through these sorts of things. And I have found that there are a few groups on Facebook where people are really generous in sharing information. Just remember, not everybody has the same circumstance. I had a congenital issue. I was born with narrow vertebrae, and that just sort of popped into my life and started happening all of a sudden. There's a lot of people in these groups that have sort of like a lot of contributing problems to this. But chances are you might be able to find someone who is in somewhat of the same situation as you, with the same levels and perhaps some of the same types of contributing factors. And if you can connect with them, I'm trying to be generous with sharing how my progress is going, and there's plenty of people in those Facebook groups that are doing the same thing. I found a group that is specifically just for the posterior surgery. And then there's a few different groups with the ACDF, with the anterior surgery too. So I will put some links to them down in the comments as well. And I would just encourage you, it's, you know, there's a lot of questions as to what we face going through this whole new world. And there's a lot of generous people that are on there that are happy to share what their experiences have been. Some of them might be a little scary, and some of them will be encouraging, and there's all kinds of people in between. And, you know, there's some people that have said, well, there's not a whole lot of people sharing success stories in these groups, and people have answered, well, they're the ones that are out living their lives and, you know, skiing and taking up other regular activities, and they're just not on here as much. But it is important to remember that there is hope, that there are people that have gone through this and have seen a lot of success from this, and that this surgery has solved a lot of problems. You know, most of us that have been recommended to have this type of surgery have probably also been told, if you don't do this, you will likely face a future with, you know, partial paralysis or being in a wheelchair or something like that. So, you know, that's why we did it. We did it so that we can promote having just better movement options in the future, and to take away the danger of further problems from this. So it's a bear to get through, but I'm hoping that at the end of this, that the fruit of the results really make it worth it. So I want to encourage you in that as well. So thanks for your time. If I can be of help, you can leave me a comment and I might be able to have an answer for you, or I would really encourage you to just link up with one or more of these groups in Facebook, and just you know, talk to some people and find someone who is in a little bit of a similar circumstance as you. There is hope. We'll get through it, and I hope this is an encouragement for you. All right, thanks.